Hey guys, it's me again, Hani, for another episode of my online Class 11 vlog. So as future physicians with a heart, I think it's very important for us to familiarize ourselves with our healthcare system, and one way is to know about the different DOH programs. Before that, did you know that in the National Objectives for Health Philippines 2017-2022, the lack of health centers led to the limited access, especially of the poor, to health, given that those who often go to these facilities belong to the low socioeconomic class. DOH then pursued Formula 1 Plus for Health, providing universal health care for all Filipinos, with a vision of Filipinos being among the healthiest people in Southeast Asia by 2022 and Asia by 2040. With the pandemic going on, do you agree that this is achievable? Thumbs up if you agree and thumbs down if you don't. There are actually 51 DOH programs. Well, anyway, if you want to know more about them, you may visit doh.gov.ph. At this juncture, I'd like to promote my fellow COVID warrior vloggers for some comprehensive and very creative DOH reports. Ta-da! So now let's go to our main topic on Philippine Cancer Control Program. The Department of Health Philippine Cancer Control Program is a systematic, organized, integrated approach to the control of cancer that can significantly alter or reduce mortality and morbidity, utilizing primary and secondary prevention at the community level and tertiary prevention and rehabilitation at both the community and hospital levels in all regions of the country. The National Cancer Control Center was abolished by virtue of Executive Order 119 in 1987. With the formation of the Cancer Core Group in May 1987, the members developed the framework for the present PCCP. However, due to the shortcomings of the program in 1990, the Administrative Order No. 89A Series of 1990 was revised to improve the PCCP, which shall be known now as the Philippine Cancer Prevention and Control Program by Administrative Order No. 2016-001. However, the Philippine Statistics Authority found that cancer ranked second as the leading cause of death for both sexes, ranking as third for males and second for females. The Cancer Coalition Philippines also found that expenses for cancer treatment actually exceeded the mean household income, which led to almost 75% of cases discontinuing their treatment. Moreover, the World Cancer Initiative placed the Philippines as the last out of 10 countries in Asia-Pacific region in terms of cancer preparedness. It's quite sad, right? A necessary solution needs to be made in accordance with the mandate of the state under Section 15, Article 2 of the Constitution, that is, to protect and promote the right to health of the people and instill health consciousness among them. And Section 11 of Article 13, that is, to adopt an integrated and comprehensive approach to health development which shall endeavor to make essential goods, health and other social services available to all the people at affordable cost with priority for the needs of the underprivileged, sick, elderly, disabled, women, and children, as well as for the paupers. That is why Republic Act No. 11215 was established and signed into law on February 14, 2019, known as the National Integrated Cancer Control Act. It is an act institutionalizing a national integrated cancer control program and appropriating funds therefor. This act is to expand PhilHealth packages for Filipino diagnosed with cancer, mandates establishment of Philippine Cancer Center to lead cancer research, treatment, training, and registration, and the provision of creation of the Cancer Assistance Fund. A National Integrated Cancer Control Program was established under the Cancer Control Division of the Disease Prevention and Control Bureau, which will serve as a framework for all cancer-related activities of the government. With this, the Philippines, together with Australia and Japan, actually have the most comprehensive national cancer control plan. So Philippines stood as the only low-middle income country with a comprehensive plan. The goal of this program is to establish and maintain a system that integrates scientific progress and its practical applications into a comprehensive program that will reduce cancer morbidity and mortality in the Philippines. The program shall have the following objectives. First, to decrease the overall mortality, morbidity, and impact of all adult and childhood cancer, to lessen the incidence of preventable cancer and treatment-related morbidities in children and adults, to prevent and manage cancer recurrence, metastasis, and secondary cancer among survivors and persons living with cancer, to prevent and reduce loss to follow-up and treatment default, which is the patient's voluntary discontinuance of treatment for more than 4 weeks, to provide timely access to diagnosis and optimal cancer treatment and care for all cancer patients, persons living with cancer, and cancer survivors, to make cancer screening, diagnosis, treatment, and care more equitable, affordable, and accessible for all, to improve the experience of cancer treatment and care of patients and families, to support the recovery and reintegration to society of cancer survivors, and lastly, to eliminate various forms of burden on patients, persons living with cancer, survivors, and their families. The 6 specific objectives of PCC, also known as the pillars, include cancer epidemiology and research, public information and health education, cancer prevention and early detection, cancer treatment and training, that is, strengthening cancer treatment capabilities of regional medical center. Specific here is the oncology training program in medical oncology and radiotherapy set up in Jose R. Reyes Memorial Medical Center and the provision of radiotherapy facilities in strategic places all over the country, including Baguio and Cabanatuan, Metro Manila, Cebu and Tacloban, Davao and Zamboanga. 5th is Hospital Tumor Board and Tumor Registries, and lastly, Cancer Pain Relief and Palliative Care. For the DOH budget in 2021, prepared by the Health Policy Development and Planning Bureau, there is a 71% change from General Appropriations Act of 2020 to General Appropriations Act of 2021 for public health programs alone. New line item included here is the National Integrated Cancer Control Program to include cancer medicines for children. Cancer is under the Prevention and Control of Non-Communicable Disease, which has an allocated budget of 373,417,000 pesos. However, Cancer Coalition of the Philippines President Paul Perez appealed that a separate line item be included in the DOH budget for 2021 for Cancer Assistance Fund, which will cover expenses in treatment not covered by PhilHealth. Bicameral Conference Committee then allocated 620 million pesos for 2021 to cover the cost of cancer prevention, treatment, and medicines. Since the NICC still remains unfunded after the Department of Budget and Management disapproved the DOH's proposal to allocate 540 million pesos for the Cancer Assistance Fund. NICC states that PhilHealth will expand its benefit packages to include primary screening, detection, diagnosis, treatment assistance, supportive care, survivorship, follow-up care, rehabilitation, and end-of-life care. Inpatient package includes mandatory diagnostics, operating room expenses, doctor or professional fees, room and board, and medicines. However, this only covers certain types of cancer including breast cancer, prostate cancer, cervical cancer, acute lymphocytic leukemia, and colorectal cancer. The specific cancer programs of the DOH PCCP are first the Lung Cancer Control Program that focuses on anti-smoking campaign, which covers 85% of all cancer site control campaign. In Article 94, Chapter 4 of RA 7394, this provides all cigarettes for sale to have a packaging with
Government warning: cigarette smoking is dangerous to your health.
Specific objectives include to inform or educate school children and adults on the hazards of smoking and its known risk of developing cancer, to prevent the onset of smoking and decrease the number of smokers, and to identify among Filipinos those at high risk of developing lung cancer. Second is the Breast Cancer Control Program, which focuses on early detection and treatment and healthy lifestyle. Specific objectives include to inform or educate all women 30 to 60 years old on breast self-examination and the importance of doing a regular monthly breast self-exam, to detect the maximum number of early-stage breast cancer by offering yearly breast exam to all 30 to 60 years of women attending a health institution, and to treat and/or rehabilitate all detected cases. Third is the Cervix Uteri Cancer Control Program, which still focuses on the early detection and treatment and healthy lifestyle. Specific objectives include to educate people about cervical cancer, its symptomatology, methods of early detection and preventive measures, to screen at least 85% of women 25 to 55 years of age every 3 years using acetic acid wash, to identify early lesions of cervical cancer, to establish a practical or applicable referral system, and to implement appropriate treatment protocol for the different stages of cervical cancer. Fourth is the liver cancer control program that focuses on hepatitis B vaccination in collaboration with the immunization program of DOH. So, Republic Act number 10152, known as the Mandatory Infants and Children Health Immunization Act of 2011, includes hepatitis B vaccine free to infants within 24 hours after birth. Fifth is the colon and rectal cancer control program that focuses on digital rectal exam or FOBT and healthy diet lifestyle in collaboration with the nutrition program of DOH. Sixth is the healthy lifestyles that sets out the relationship between lifestyle and degenerative or late onset disease with emphasis on cancer. Lastly, the cancer relief program focuses on cancer pain relief and support groups, rehabilitation, and hospice care. This primarily implemented the WHO analgesic ladder, cutting the second step that is weak opioid from the original 3-step. With these programs, the index of cancer preparedness of the country is in the lower end of the scale, together with Indonesia and Vietnam, with the Philippines having no national screening program for breast cancer, having clinical breast examination only, and there's also the unavailability of the fecal occult blood testing and your colon cancer screening in the public primary healthcare level. Current interventions implemented by DOH parallels the most common cancers in the Philippines. Packages of services include free cervical cancer screening provided every year in 81 DOH hospitals done during the month of May to screen women ages 30 to 45 years of age. The Breast Cancer Medicines Access Program, which is a free medicines access program for a continuous free supply of anti-cancer medicine, and also to promote early screening and cancer awareness by emphasizing that detecting, treating, and managing cancer in the early stages improve overall prognosis. Free adjuvant chemotherapy for women diagnosed stage 1 to 3B breast cancer are offered in 4 pilot hospitals, including Jose Reyes Memorial Medical Hospital, East Avenue Medical Center, Rizal Medical Center, and UPPGH. Expansion sites include the Amang Rodriguez Memorial Medical Center and Bicol Regional Training and Teaching Hospital. This is funded by the National Center for Pharmaceutical Access and Management. So who can avail? A fully eligible cancer patient can avail of this program with referral from his or her surgeon or oncologist to the Patient Navigation Program managed by the Philippine Cancer Society. So the third package of service include the Acute Lymphocytic Leukemia Medicines Access Program, which offers free chemotherapy for acute lymphocytic leukemia among children with cancer funded by the NCPAM. List of hospitals include the following. Extension sites include Hospital ng Makati, University of Santo Tomas Hospital, Silliman University, St. Elizabeth Hospital, and Tarlac Public Hospital. Future plans or action is to strengthen the implementation of an integrated lifestyle-related disease control program for the promotion of healthy lifestyle and avoid population risk exposure, to maintain the operation of an integrated chronic non-communicable disease registry system in all health facilities, the development of service package for cancer control program, development of clinical practice guidelines for cancer control program, and development of strategic framework and 5-year strategic plan for cancer control program. The Cancer Awareness Campaign of DOH includes the Liver Cancer and Viral Hepatitis Awareness and Prevention Month for the month of January as mandated by Republic Act number 10526, the National Cancer Awareness Month for February, the Colon and Rectal Cancer Awareness Month for March, Cancer in Children Awareness Month for April, Cervical Cancer Awareness Month for May, Prostate Cancer Awareness Month for June, Lung Cancer Awareness Month for August, Thyroid Cancer Awareness Week at the 4th week of September as mandated by RA 10786, Breast Cancer Awareness Month for October, and Cancer Pain Awareness Month for November. What has been the impact of COVID-19 on the program? Department Memorandum Number 2020-0309, released last July 9, 2020, issues the guidelines on the continuous provision of service delivery for cancer diagnosis, treatment, surveillance, and palliation. The implementing guidelines include optimizing service delivery settings and platforms by limiting the face-to-face consultations, by scheduling consultation in health facilities, and doing telemedicine when the risk of exposure to infection outweighs the benefits. Also included is to establish effective patient flow at all levels, that is, establishing a strong referral mechanism and prioritizing cancer patients to be seen first in health facilities based on their underlying cancer status and risk for COVID infection. Third is to rapidly redistribute health workforce capacity, including reassignment and task shifting, and and to identify mechanisms to maintain availability of essential medications, equipment, and supplies. So access sites of Breast Cancer Medicines Access Program and Childhood Cancer Medicines Access Program shall continue to provide free cancer medicines to eligible patients in selected DOH hospitals and the Philippine General Hospital. Can cancer patients get COVID vaccination? Preliminary recommendations of NCCN COVID-19 Vaccination Advisory Committee include patients with cancer should be prioritized for vaccination and should be immunized when vaccination is available to them. Immunization is recommended for all patients receiving active therapy with understanding that there are limited safety and efficacy data in these patients. Reasons for delay of vaccines are similar to those that impede delivery to the general public, that is recent exposure to COVID, and also cancer-specific factors such as vaccination should be delayed for at least 3 months following hematopoietic cell transplantation or engineered cellular therapy to maximize vaccine efficacy, and delay until absolute neutrophil count recovery for hematologic malignancies receiving intensive cytotoxic chemotherapy. Caregivers and household or close contacts should be immunized when possible. Before we end this, as per the Department Circular Number 2021-0058, declaring February as the National Cancer Awareness Month, with February 4 as the World Cancer Day and February 15 as the International Childhood Cancer Day, here are 6 take-action tips for reducing cancer risk. First, maintain a healthy weight and active lifestyle. Second, avoid smoking and tobacco products. Third, always wear your sunscreen and protect yourself from the sun by staying out of the sun between 10 a.m. and 4 p.m. Fourth, get immunized. Fifth, get screened. And lastly, know your family history since 5 to 10% are inherited. I guess this vlog and DOH reporting has finally come to an end. Well, anyway, don't forget to subscribe to my YouTube channel. So wear your face mask properly and observe social distancing. Annyeong!
잘 지냈어요 모두 보고 싶소 이동 고잉은 언제나 너에게 going
Ooh, cancer. 6 tips for reducing cancer risk. Maintain a healthy weight and active lifestyle. Stop smoking and avoid using tobacco products. Wear your sunscreen, sun protection. Vaccinate yourself and get yourself screened for cancer. Know your family history. Yeah. 6 take action tips.